If you have back pain because you have bulging discs or disc herniations, it can be very painful. And you just want to get your life back. You're restricted because of the pain, right? Well, in this video, I'm going to show you 5 exercises that I teach people on how to improve their pain if they have bulging discs or disc herniations. I'm Dr. Sean, your PT guy, and our videos help you learn how to move better and stay independent so you can enjoy your life. Let's get started. Disclaimer! So when someone has bulging discs or worse, a disc herniation, they are oftentimes not going to want to do anything where they have to put their bodies in a forward bending position. If they have to pick up their child or their grandchild, that's going to be painful. If they have to pick something off the ground, if they have to sit for prolonged periods of time, if they have to cough, if they have to sneeze, all of these things will increase that pain, oftentimes with bulging discs and disc herniations, especially disc herniations. So what's actually going on here? If you look at a spine model, you have the neck and then the thoracic part with the ribs coming along. You have the pelvis down here. Most disc herniations happen in the lumbar region down here, in your lower back, lumbar, lower back. Actually I have this model right here too. This model shows this is a lumbar spine, and this right here between the two bones is your disc. It's kind of like a jelly-filled donut. Look, it's squishy. See that? Look, it can rock back and forth, squishy. It's nice. But there's a protective layer around the outside of this disc. Sometimes, if you have trauma or from prolonged use, sometimes your disc can actually squirt out like that. That's a bulging disc. Or if that goes inside of your spinal canal and then those little pieces break off in there, that's a disc herniation. So when you go forward, again, this person's like this. So if I go forward, you can see what that does. Watch. Okay? When someone has an issue with the outside of their disc itself, it can actually protrude in the back. Look at that. Right on that nerve. When that pushes down on your nerve, pain. Watch out. So we need to figure out how to fix this. So now let's go over those 5 exercises that will help with bulging discs and disc herniations. The first 3 we're going to do laying down, and the last 2 we're going to do standing up. What I love about the last exercise, which I'll show you in a moment, is it can be done anywhere. You don't have to lay down. But these first 3, which I would prefer you to do them in order if you can, we're going to do it on a treatment table. You can do it on a couch, you can do it on the bed, you can do it on the floor if you can. Just make sure you can get up, okay? So the first exercise we're going to do, we're going to lay on our stomach. When you lay on your stomach, you're putting your spine in that straightened extension position. Because remember, if you're coming forward, what's that doing to that disc? It's pushing that material out. So if you go backwards, or if you lay on your stomach, you're actually pushing that material inward. So that's the goal of what we're trying to accomplish. Eventually, if you can push up even more and bring your spine back more, that's going to be even more beneficial. But you may not be able to actually get up on your forearms or even your elbows. So if you need to just stay laying on your stomach for a minute or 2 minutes, do that. That's the first exercise. Let me show you what I mean when we're talking about a prone press up. I'm going to lay down on my side with the log roll technique to protect my spine, okay? And then from here, if you just need to lay flat on your stomach, go for it, okay? But if you can get up on your elbows like I'm doing, that's even better. And eventually, you want to get to the point where eventually you're able to do this, okay? See how my elbows are locked out? They're straight. And notice my pelvis is always staying glued to the treatment table or the bed, wherever you're doing it. So start off here. If you can get up on your elbows, great. Aim for 10 repetitions. 10's fine. That's all you really need to do right now. And then come back down. So you come up and then back down. And you come up and then back down and so forth. Okay? You're providing that extension moment. Now, if you can get to the point where you can do this, that's even better. Just make sure your pelvis stays glued to that treatment table. So you come down, you come on up. It's kind of like a push-up almost, but you're keeping your pelvis down there, okay? So like this and there. So that's a prone press up. 10 repetitions is what you're aiming for. Now on to the next exercise. Now the second exercise is going to still be working that extension, but we're going to do it from the bottom up instead of from the top down. So this is called a prone hip extension. The same concept, we're trying to provide extension to the spine so that that material goes back in. So for this one, you're going to lay like this, okay? I actually like to just keep my hands here. And what you're going to do, keep your feet kind of off of the bed or the treatment table where you're at. And from here, you're just trying to bring your leg straight up, okay? Notice my knee stays straight. So you bring your leg straight up and then back down. And straight up and back down. Now you don't have to be on your elbows. I just prefer to be on my elbows. It gives a little bit more of a stretch. You could be on your stomach and your shoulders, that's fine. But you're trying to just bring your legs straight up and back down. Biggest key, just make sure your hip stays on that table or treatment or bed, wherever you're at. So again, 10 repetitions. Prone, hip extension. And I like to do both sides, just even it out, okay? Just make sure that your spine, your pelvis, stays on the treatment table at all times. 10 repetitions. On to the next one. So now the third exercise, we're actually going to have you on your back for this one. You're going to be on your back and you're going to put your feet on the bed or the treatment table or the floor, wherever you're at, in the hook lying position. So bend up both knees, put both feet flat on the bed, keep your hands here. And what you're going to try to do is you're going to try to lift your pelvis up to make it in line with your knees and your hips, like this. You're going to come straight up like this and then back down. Again, you can see my spine is flexed here and I'm moving into it being straight, the extension, okay? So how many? 10. That's all you need to do for right now. Just come up and then back down. Now when I say 10, that's the number of repetitions for the sets. 2 to 3 sets is great. You're gonna just do what your body feels, okay? If your body loves it, you're gonna wanna do more, okay? So you're gonna come up like this, okay? So that there's a nice line right from my knees to my pelvis to my shoulders, okay? Back down. So it's going to come up and back down. So this is exercise number 3. Now let's get to exercise number 4 and 5. Now oftentimes with a bulging disc or a disc herniation, you're going to find that you're going to want to lean away from that hurt side because that disc is blowing out the back over there. So you're trying to get away from that. But we need to correct that because if you walk around like this, now you're going to get pinching on the other side. We don't want to do anything like that. So we need to kind of eventually correct this lateral shift that we have. And that's what this next exercise does. So let's assume your pain's on the right side. And so you're kind of shifting your weight over here. You're kind of walking around a little bit, you know, leaning to that left side because you got the pain over there. So what you do is you put your good shoulder, your good side shoulder, against the wall, okay? You put it against the wall, and you can bring your arm out like this to create a little bit more space, all right? You're gonna put your arm against the wall, and eventually what you're gonna wanna try to do is take your other hand and slowly see if you can bring it towards the wall. You're kind of leaning into the wall, and you're trying to bring that hip in towards that wall, okay? You're just kind of shifting that weight a little bit into the wall, and eventually you're going to want to try to see if you can get all the way over to that wall, and that's going to help straighten out your spine. So this is our fourth exercise, a lateral shift correction. You're going to put your shoulder on the wall, arm out to the side, and then eventually start working your way into that side. If you have a lateral shift and you find that you're trying to avoid going over, this is an important one to make sure you do before the last exercise. And if you don't have this, then just go straight into the last exercise. Now the last exercise, which I love, can be done anywhere, anytime, because all you need to do is remember, we're going to try to bring our spine backwards. So you put your hands on your belt line, okay, your hips and your belt, and what you're going to do is you're going to keep right there, have a wide stance, and you're just trying to lean back as far as you feel like you can, okay? And then come on back up. Eventually, as you go, you're going to find that you're going to be able to go a little bit farther back each time, okay? So a little bit more, a little bit more, a little bit more. 10 repetitions, okay? Now, it is helpful to make sure you do this, maybe at first until you get the hang of it. Do it where something's behind you, okay? Like I love to do it in front of a chair or in front of my table or your bed, just in case, because when you're leaning back, you don't want to do that. It can get a jolt sometimes. So just be careful. Bring your hands here. You're going to lean on back and just try to get back as far as you're able to go. Do your best to try to keep your hips basically where they are. You don't want to kind of just lean back like this and bring your hips forward like that. That's going to throw your balance off. Just try to keep your hands right here, and my thumbs are pushing in, and what I'm going to try to do is just lean back, okay? So I'm just trying to lean back. Best part about that exercise, it can be done anywhere. And you may find that when you're leaning back, you may find that maybe you're leaning back and you need to lean a little bit to the right. Or you may find that when you're leaning back, you need to lean a little bit to the left. Try it out. Try out 10 repetitions on each side and in the middle and see where your body is telling you where you need to go. Listen to the body when it's telling you where to go. That's your goal. So those are 5 exercises that will help you improve your back pain and, more importantly, help you get your life back if you're suffering with bulging discs or disc herniations. Try them out. Let me know in the comments below how they're helping you. I'd love to see that. If you want more videos just like this one to help you learn how to move better and stay independent to enjoy your life, click the subscribe button down below, and we'll see you in the next video.